Hey team, Peter Halstead here, physiotherapist and director of Fit3d New Zealand. Thanks for joining me on this quick video to let you know how Fit3d can add the wow factor to your body assessments and create the perfect stamp of success for your clinical interventions. Body scanning is now commonplace worldwide and has been used more frequently in the appearance medicine market. The opportunity to own your own Fit3d body scanner is now a reality in New Zealand. I'm just going to take you through some of the key Fit3d features and how they can add value to your business. So once you do a Fit3d scan, it only takes 35 seconds and 3 infrared cameras take over 1,200 photos of the individual. And within a couple of minutes, you'll have full access to all their results. They'll have access to hundreds of measurements on their phone or computer via the Fit3d app, and you as an administrator will have access to all their results in one place under the administrator app. Once they log in as a client, they'll get a report. The report will look exactly like this. Now, the Fit3d system is completely visual. Numbers alone mean nothing. The feedback we've had from multiple Fit3d machine owners is that the combination of Fit3d images, graphs, and objective data elicit an emotional response that numbers alone on a piece of paper do not. This may significantly help client buy-in to your interventions. Now, Fit3d has multiple features that will show changes in body composition. For example, on the screen at the moment, we've got body fat percentage, weight, fat mass, and lean mass, and it will color code each of those numbers. Green is good, red is bad. Your patient will be the dotted line. And Fit3d have done thousands of scans around the world, and from that data, they can give your client an indication of where they sit worldwide for their age and sex. You can also get features such as basal metabolic rate, body shape rating, waist circumference, waist to hip ratio, etc. Fit3d will also do a full posture assessment on each client with a front, side, and back analysis, and you'll get images, and it will show the shift left and right. It'll also show, for example, in this picture here, how much someone's head is protruding forward or shoulders are rounded, hips are tight. Each Fit3d scan comes with a 4 balance feature, so it'll show forefoot or hindfoot distribution, pressure, or left and right imbalances. The 1,200 photos create the 3D images, and then specific slices are taken at each point, and then you'll get from that differences in your left and right biceps, your arms, your thighs, and your calf muscles. So for those looking for any imbalances, or those wanting to trim up the thighs or the arms, you could visibly get a baseline measurements from one Fit3d scan. Now it gets a lot more interesting when you start comparing scans over time. So if you want to do a scan before an intervention and after, here's what you'll see. You just click on comparison mode and it can compare 2 images over time. On the screen right now, you'll see that this person, their bottom slightly different on their left compared to their right. You'll see the stomach slightly larger on the left compared to the right. You can twist this image around in all directions. So you can look at front on, which you'll see that the V angle around the waist is slightly different on the left and the right. The breast is slightly bigger on the left compared to the right as well. It also graphed all the different metrics on the right and show baseline versus current in the top right-hand corner. Appearance medicine is, most of the clients, they usually like sharing their results. They'll share their before and after images, and the objective data are bound to generate more leads for your business and enhance your reputation as an appearance medicine specialist. You can also put images on top of each other. So these overlay and comparison images combined with the objective data will give your client complete confidence that change has occurred. Essentially, Fit3d takes away the subjectivity out of the assessment and the reassessment process. Again, you can compare circumference measurements on the right. You can isolate those graphs on the bottom right just by clicking on them. And it will compare torso, arms, legs. So if you're trying to change leg circumferences with intervention, it can show. It may not be the purpose of your treatment, but posture can be compared over time as well. And it may just be another benefit that you can show the client, or an unexpected benefit that you can show the client, a positive impact of your intervention. Just bonus points, essentially. For those who really want to geek out, there is an additional measurement section which you can use for clients. In this section, I've just highlighted left arm volume versus right and left leg versus right volume. For those wanting to change the volume of their arms and legs, this could specifically show you down to the nearest 100 grams. For those changing their torso, you can also show someone how much volume they've lost specifically in their torso. There's other features on here such as arm length and leg length as well. That's just some of the main Fit3d features that I've shown you. Other ways you could use Fit3d is you could take it out of the clinic. It is completely mobile and fits in the boot of a car. You could take it and team up with other businesses and generate leads for yourself, or team up with other health professionals, and it's a perfect way of generating leads. You'll find that a lot of clients, especially in appearance medicine, they're going to want to share their results, and the overlay feature is the perfect feature for that. In this sample on the screen right now, blue was their most recent one and black was their first one. This person has completely changed their shape, which photos alone is sometimes difficult to show. They're just the main features. If you have any questions about what I've been over, or if you'd like to inquire more about Fit3d and how it can enhance your business, please get in touch.